And for our first presentation, I have the pleasure of inviting Dr. KJ Reddy from Apollo Hospitals, Jubilee Hills, Hyderabad, to speak on joint preservation, the path less taken but the need of the hour. Over to you, Dr. Reddy.
Good morning, respected dignitaries and my colleagues, press and print media. Thank you very much for coming over and spending time. That's because you are the people who can take forward the message or the information to the society. We feel in this journey, you are the most important part of this program. నేను తెలుగులో కూడా చెప్తాను ఏంటిదంటే జాయింట్ ప్రిజర్వేషన్. Joint preservation is not rocket science. Joint preservation means preserving our own joints and how we can do it. Probably can I have my presentation? Is there? Oh, the right, okay. So this is so if you see important structures, 7 wonders of the world, they're preserved in a way that will not last forever. Similarly, we have the technology, we have the knowledge to preserve our joints. And every day it's getting better. And as you can see, so many technology will come. You might have heard so many in the media advertisement giving injections into the knee joint, PRP injections, other things, which will improve the joints or repair joints. That's only one part of it. But there's so many other ways. The basic principle in joint preservation is protecting our own joint structures, which are ligaments, cartilage, and the joint surface itself. So we have to take all the precautions to prevent any damage. About osteoarthritis, do we know the cause exactly? Probably we do not understand, but we know the process, what happens. Osteoarthritis, what happens when we do day-to-day activities, there's little damage to the articular surface, maybe little injury, jumping, running. Normal person will be able to repair that articular surface. In arthritic patients or prone for arthritis, the repair mechanism is lost. That's the bottom line. Why it's lost, still a lot to understand, but I think there are some clues which we know. And can we prevent it? Yes, some of the arthritic cases we can prevent, especially injuries, ligament injuries, meniscal injuries, cartilage injuries, anything, any alignment. మీరు చూసింటారు వంకరగా ఉన్న కాళ్ళకు ఆపరేషన్ అంటే ముందే ఆపరేషన్ చేసి ఆర్థరైటిస్ను కంప్లీట్గా ప్రివెంట్ చేయొచ్చు. ఎవరికైతే నీ ఇంజురీస్ అయి ఉన్నాయో చిన్న చిన్న ప్రాబ్లమ్స్ సాల్వ్ చేసి ఆర్థరైటిస్ ప్రివెంట్ చేయడానికి వీలవుతుంది. సో వీ హ్యావ్ ది మెథడ్స్ టు prevent arthritis. See that man, 40-year-old man had an injury, went to the doctor said X-ray is normal, go home, gave some painkillers. But what happens is the pain symptoms, swelling persisted, so got an MRI scan. As you can see, there is injury to the articular surface, which is not seen on X-ray. And you can see there, you have a pointer here? No pointer, okay, no problem. So you can see, if you leave it like that, what happens is it will lead to arthritis. So we can prevent this one. Had we diagnosed that cartilage damage in the beginning, we could have prevented this arthritis. So evarikaithe ee joint injuries unnavo, so we can diagnose. So those, namaste madam, those evarikaithe knee injuries ayi pain swelling taggaledo, you must get an MRI scan. Then only we can make out any damage to the ligaments, cartilage or meniscus. If you treat them, it will not go to this stage, and the next stage, all of you know, would be replacement. So we can prevent treating these conditions properly. And as you can see, if we diagnose early, so that's the damage, real damage. We can do stem cells. We can grow stem cells, especially cartilage. మన ఓన్ బ్లడ్ బోన్ మ్యారో తీసేసుకొని ల్యాబ్లో కాండ్రోబ్లాస్ట్ అంటే స్టెమ్ సెల్స్లో వెరైటీస్ కాండ్రోబ్లాస్ట్ అక్కడ ఇంప్రిగ్నేట్ చేసేసి దెన్ వీ కెన్ గ్రో కార్టిలేజ్ హియర్. దట్స్ వాట్ యు హవ్ డన్. యాజ్ యూ కెన్ సీ, దట్స్ ది no, but I want to point that. Okay, no. So that is, I think, chondroblast impregnated. Simple way, what we do, we take sample from the non-weight bearing part of the knee joint with a simple tool, send it for the lab, grow the chondroblast and implant it. When we have about few million cells, we put them and put them in a fibrin glue. The technology has developed. Previously, we used to impregnate, but they used to disappear into the joint. But we have the technology mixed with fibrin glue, which will stay there for activity seen up to 18 months to 2 years. And we have done cases, that's our series, with reasonable results. You can see other parts. This is a patella. Patella is a very common cause for pain as well as chondral injury. If you diagnose early, we can do this procedure and we can save the knee as well as prevent osteoarthritis. That's the chondroblast. And we can replace entire patella with chondroblast. And this other, just go through. So this is MRI scan pre-operatively. As you can see, the post-op MRI scan in the bottom, the lesion completely healed up. And this is the pre-operative arthroscopy, where the lesion you can see, and on the right side is post-operative. After 1 year, the cartilage completely healed. So we have the ability to heal the cartilage. That's what part of the joint
recording in
preservation.
progress.
And of course, one of the other condition is AVN, where blood supply is lost in the femoral heads. We can do something to prevent osteoarthritis. ఈ కోవిడ్ తర్వాత చాలామందికి గ్రాయిన్ పెయిన్, హిప్ పెయిన్ వచ్చేసి హెడ్లో బ్లడ్ సప్లై ఆగిపోయి కొలాప్స్ అయ్యి ఆస్టియోఆర్థరైటిస్ వచ్చి హిప్ రిప్లేస్మెంట్కి వస్తున్నారు వెరీ యంగ్ ఏజ్లో. అంటే యాజ్ ఏ వీ హ్యావ్ డన్ ది యంగెస్ట్ ఈజ్ 14-year-old girl, severely crippled with AVN. So if that's the, you can see MRI scan, there is AVN, blood supply is lost in the MRI scan. And if you leave it without any intervention, it will progress to osteoarthritis. And the option would be hip replacement. We can prevent it, preserving the joint. We have the technology of early detection as well as treating these condition. So it's also simple what we do. We take the blood, bone marrow from the pelvis, send it to the lab, grow stem cells which will demyelinate into osteoblast, bone growing stem cells, and impregnate into the, we take the under X-ray control. Can we forward the slide? Not coming. Yes. Can see. Let's go back there. That's MRI scan. In the bottom you can see we have done, where is that? It's coming, okay. So we have done core decompression, and after 1 year they should be able to do most of the activities. I think they should be able to squat, they should be able to walk, and we can preserve the hip joint completely. So ఎవరైతే ఎర్లీ డిటెక్ట్ చేసేసి, అంటే స్టేజ్ 4 స్టేజెస్ ఉంటాయి, ఫస్ట్ సెకండ్ స్టేజ్లో డిటెక్ట్ చేస్తే బై MRI స్కాన్ స్టెమ్ సెల్స్ గ్రో చేసి ఇంజెక్ట్ చేసి డెడ్ బోన్ తీసేస్తే బ్లడ్ సప్లై మళ్ళీ వస్తుంది, హిప్ ప్రిజర్వ్ అవుతుంది, సర్క్యులర్గా ఉంటుంది స్ఫెరికల్గా, సో దట్ ఆర్థరైటిస్ రాదు, లేటర్ ఆన్ రిప్లేస్మెంట్ అవసరం ఉండదు. సో Here also we done cases. Those are the. So, in brief, this is methods, but as I said, joint preservation, there are various modalities. I only showed two, but preserving the normal structures, ligaments, cartilage, articular surface, any day-to-day damage, if we detect early, treat them, we can preserve the joints very long time. And the key is early detection of these problems and treating them appropriately. And the best health for the joint is exercise is the best way, good food, of course, rest, good sleep. These are the three things for general health as well as joint health as well. So probably we'll open up later on for any question answers. Thank you very much for your attention.
Thank you, Dr. KJ Reddy, for those insightful words and highlighting the importance of joint preservation in today's healthcare landscape.
Yes, we can hear you, sir. Please go ahead.
I am Abhijit Chanda from News 18 Bangla, West Bengal. Say, my question is, what innovative treatments does the clinic offer, especially mainly, just a minute, avascular necrosis or osteonecrosis, and congenital dislocation of the hip joint, CDH means, or hip dysplasia.
Dysplasia, okay. ठीक है, ये avascular necrosis means blood supply to the hip joint is compromised. కొన్ని రోజుల వరకు తగ్గి మళ్ళీ స్టార్ట్ అవుతుంది. Because of that, the head, ball of the head becomes weak, it collapses and gets into osteoarthritis, which needs replacement. So, if we can intervene, there's so many ways of delaying this process. If we diagnose early, there's so many various ways, but none of the procedures are 100% guaranteed. So we can, if we diagnose early, there are various means of treating this condition. And second question was DDH or CDH, congenital dislocation, is entirely different one. It is happens in children. You can prevent it. If we diagnose early, we can make them a normal hip if we treat it before they start walking. If we leave it, probably they will get into osteoarthritis later in life.
Thank you.
Do we have any other questions, sir, from anybody?
Anybody can answer. Is there a possibility of knowing that when you inject a stem cell, there is an immune rejection? Because, you know, after going through the process, if there is any rejection,
I think the chances of that are extremely low since it's essentially the person's own tissue. So the chance of rejection is extremely like to zero, effectively. Yeah.
Ma'am, and also I think with this program, what we kind of explore further is that since the stem cell research and are all very happening and ongoing, there will will be major breakthroughs that will come on the way. So we want to kind of start a program where we offer a holistic approach, and as and when there is a scientifically validated breakthrough that happens in that space, we will adopt it and kind of introduce to our patients rather than just talking about one product that can help any patient.
Yeah, I think the focus on stem cells also highlights that it's part of an excellent program will be the things that you say you can't do. And for patients to work through a program over a chronic care type of situation, trust is really high. And part of the program, I'm sure, will be around looking at what's working, what doesn't work, and only introducing the ones where it works in the right way. And stem cells are so attractive as a concept, but still relatively in their infancy of treatment. But that's not to say there are lots of other treatments that are underdone because people just aren't aware. So this will raise the awareness of all the other interventions that are possible and useful and scientifically backed, with the ongoing research on the stem cells there at the forefront to introduce at the right time.
అండ్ దీనివల్ల ఏంటంటే అవేర్నెస్ చాలామంది ఏం చేస్తారంటే నీ జాయింట్స్ కానీ హిప్ జాయింట్స్ వస్తే చాలా నెగ్లెక్ట్ చేస్తూ ఉంటారు, డిలే చేస్తూ ఉంటారు, సివియర్ అయ్యేంత వరకు రారు హాస్పిటల్కి. సో ఒక స్క్రీనింగ్ ప్రోగ్రామ్ అనేది ఉంటే మనకు తెలుస్తుంది కొంచెం వచ్చినా కూడా ఓకే ఏది చిన్న చిన్న మైనర్ ప్రాబ్లమ్స్ వచ్చినప్పుడు అవి ట్రీట్ చేయగలుగుతాం. ఎందుకంటే ఇప్పుడు మన హార్ట్ డిసీజ్కు, షుగర్కు, బ్లడ్ ప్రెషర్కి ఏంటంటే స్క్రీనింగ్ ప్రోగ్రామ్స్ ఉన్నాయి. ఆ విధంగా జాయింట్స్కు, నీ జాయింట్, హిప్ జాయింట్ అనేటికి స్క్రీనింగ్ ప్రోగ్రాము దీనివల్ల ఏమంటే రిడ్యూస్ అవుతుంది. ఎర్లీగా ప్రాబ్లం డిటెక్ట్ చేసి దాన్ని ప్రాపర్గా మేనేజ్ చేస్తే ప్రాబబ్లీ కంప్లీట్గా డిలే రాకపోవచ్చు, డిలే చేయడానికి పాసిబిలిటీ.
Sir, have you done any study before starting this program here at your center in any of the hospital in across the country in Apollo Hospital? Have you done any study or observation or any survey related to this? And if yes, what are the results?
Survey, see, there is so much of data is available, and whatever we are doing, we documented, we published. Whatever procedures we are doing, it's a documented one. That means scientifically backed and validated. Whatever treatment we are giving is a validated treatment. If we give it to 100 people, at least a significant number, 70-80% to get benefit. Then only we come into the clinical practice. There so many trials were done, then we get into the clinical practice. Does that answer your question? Or?
So I'll also try to answer that question, sir, if you allow. So this program kind of involves three major pillars. So we have the awareness part of it, we have the clinical part of it, wherein we actually give those treatments. So all those treatments are all scientifically proven ones, all validated data, all the therapies which are already approved by all the scientific bodies. So it's not an experimental treatment that we are offering here. And the third part would be the medical research, which we will be kind of amalgamating along with the overall program. So, yeah, so therapy won't be experimental here.
So it's all available treatments. We are streamlining it, making aware to the society that these are available, and further research will be integrated into these treatment modalities.
Okay, actually I have one more question. Like, I really want to know that what is actually orthobiological therapies? How do they like help in healing damaged tissues and reducing inflammation without surgery?
Yeah, I think what happens is we have to assess what stage is the condition and what exactly the problem. And orthobiologists have specific indications wherever there is a definite problem. If it is meniscal tear, ligament tear, or malalignment, this orthobiology is not going to work out. If there is a problem of little wear and tear, maybe little trauma, injury, where there is a problem with the healing, then this will work. So we have to assess, as Dr. Brett said, we have to assess exactly the most important thing in orthopedics, especially knee, and in medicine, is making a diagnosis. That's a key for any management of their treatment of the disease. So diagnosis is the key for a successful treatment.
Okay, thank you so much.
Many thanks for the question, ma'am. So if there are no other questions, we'll now close the session. I invite everybody for a lunch. Thank you so much.
Wonderful. Well done. Ravi, well done.